Dr. Mario Ramirez served as acting director of Health and Human Services Pandemic and Emerging Threats Office in the Obama administration. He's also an emergency room physician in Nashville who's been treating COVID-19 patients and just finished an overnight shift. Dr. Ramirez, we're so grateful. I know how busy it is in an ER on 4th of July. We appreciate you getting up and spending some time with us this morning. What are your concerns as you look at these celebrations? I can just say anecdotally, a lot of people were out treating the 4th of July just like any other 4th of July in big groups and having big parties and everything else. So as we see these spikes across the country, including in your state, what are your concerns about this holiday weekend?
Well, you're right, Willie. I mean, having worked overnight, I can tell you that people are certainly out celebrating. As I just experienced, it was a really busy night here. I think we're at an inflection point for the country. I think people are looking around and realizing that we're at a very different place than we were when we were coming off of the Memorial Day holiday. So when we look back at Memorial Day, we were coming off of the lockdowns and the case counts were coming down. And I think the message that people were hearing was that we had sort of moved past this and states were starting to reopen pretty aggressively in some cases. And I think as a result, people started to socialize too aggressively. Now, I think more and more, particularly over this last week, people are really realizing that case counts are accelerating upwards. And I think that's giving people a lot of cause for concern. I think there are some bright spots. I think in the last week, we've seen a number of states start to implement mask ordinances. I think we're up to 22 or 23 states. In addition to that, I think, anecdotally, I'm hearing from some of my patients that they're starting to take the social distancing a little more seriously this week after seeing what's happening. What I think people have learned is that this isn't just a Northeast phenomenon, or it's not a red state or a blue state phenomenon, that this disease can really spread anywhere. And that, if you're out and you're socializing, you're vulnerable. And so my hope is that all of these things that have been put in place over the last week are going to pay dividends over the 4th of July sort of follow-on period that we didn't see after Memorial Day.
Yeah, just to put it in its perspective, in the last 10 days, our country has seen nearly 500,000 new cases of coronavirus. So as you say, we certainly have not turned a corner yet. I want to ask you, as you focus on some of that promising news about the possibility of a vaccine, I think it's becoming more and more clear that we'll never quite be through this really until there is a vaccine for everyone. Where are we in that process? The president yesterday and the day before, again, just touting that there's something coming soon on the horizon. Dr. Fauci has shown some optimism, but perhaps by the end of the year or early next year. But that feels like a long way away to a lot of people. So where are we in that process?
Well, we're making some progress, Willie. I think you got to look at this sort of pandemic in sort of two parts. So the first is what's happening with this sort of immediate disease outbreak. And like you pointed out, there was a lot of sort of bad news and news that's not encouraging as these cases accelerate upwards. On the other hand, I think that we're making better progress on the therapeutic and vaccine front. So, just to put things in context, what I want people to really realize is that all of this work that we're doing around masks and social distancing is about trying to keep case counts as low as possible until we can bring these things online. And I think they're going to start coming online as we approach the fall. From the therapeutic standpoint, I know folks have heard a lot about remdesivir. They're starting to hear more about a medicine called dexamethasone that's shown some improvement. And I think as we get into the fall, we're going to see things like monoclonal antibodies and fresh frozen plasma that are going through their clinical trials right now and should be available for use. On the vaccine front, there's really a lot of good movement. So globally, we have about 140 vaccines that are currently in development. Of those, about 18 are in phase 1 and phase 2, which are early clinical stage trials. There are now 3 vaccines that have moved into phase 3 trials, which is really promising. From the U.S. perspective, they are managing sort of all of that through something called Operation Warp Speed, which is run out of the Department of Health and Human Services. And their goal is that we'll have 300 million vaccines by January 2021. I think there are some encouraging signs as we see more and more vaccines moving into phase 3 trials that we might actually be able to reach that goal. It's never a certain thing, as we've heard from Dr. Fauci this week, but we're hopeful that we're going to get there.
Dr. Mario Ramirez, again, I know it's been a very long night for you. We're grateful that you would spend some time with us and talk us through all of this. Thanks so much.